Hello, this is Akram Jafar, and today I'm going to talk briefly about the histology of the liver. Here you can see how the portal vein and the hepatic artery, they branch within the liver into smaller and smaller branches until they form the portal triads. Histologically speaking, the liver is structurally formed of hexagonal hepatic lobules. Within these lobules, the hepatocytes are arranged in laminae. These are the adjacent hepatocytes, and in between these hepatocytes, there are sinusoids containing blood. The blood is going to flush these hepatocytes. Sinusoids are wide and fenestrated capillaries. You can see here, this is representing the wall of a sinusoid, and within the hepatic lobule, this is the location of the sinusoid. And these cells, again, they represent the hepatocytes that form cords in between the sinusoids. Bile produced by the hepatocytes collects into small biliary passages, also located in the portal triad. So in the portal triad, we have, this is a biliary passage, we have a branch of a hepatic artery, and this is a large branch of a portal vein. This is a vein, but it has branches unlike other veins because it is a portal vein. A portal vein, by definition, is a vein that joins two capillary networks. So it starts in the capillaries that are present in the wall of the gut. These unite to form venules and then veins until they form the portal vein. And then the portal vein is going to branch, unlike other veins. These branches are located in the portal triad. Therefore, blood that enters into the sinusoid in between the hepatocytes comes from two sources. It comes from a branch of the portal vein, and that will be nutrient-rich, and it comes from a branch of a hepatic artery, and that will be oxygen-rich. The blood will pass in the sinusoid, providing nutrients and oxygen for the hepatocytes, and so this is the direction of blood flow until it reaches a central vein, which is located in the center of the lobule. That's why it's called the central vein. It's a small venule. And then these central veins are going to collect and form the hepatic veins. These hepatic veins, they open into the inferior vena cava. Inferior vena cava, of course, will open into the heart. This is a normal histological section of the liver. In the hepatic lobule, you can see here is the central vein, while at the angle of the hexagon, one of the angles, we can see a branch of the portal vein. So the blood will pass from the portal vein into these sinusoids in between the hepatocytes until it reaches the central vein. In addition to that, there is an accompanying artery which is not shown in this section, and so the blood from the artery is going to pass again in these sinusoids, and as the blood reaches the central vein, it is depleted of its oxygen. At the same time, bile that is produced by the hepatocytes is going to collect into small biliary passages, and these will join to form a small bile duct in the triad, and so the direction of flow of bile is toward the periphery, while the direction of flow of blood is toward the center of the hepatic lobule. One other cell should be mentioned here is this is the Kupffer cell, and you can see it here in dark color. Multiple of them are located at the border of the sinusoids of the liver. They are in fact tissue macrophages, and they are responsible for removing debris, bacteria, as well as the senile RBCs.